it's okay.
How old is he?
He's
Every day, a child is born in Nigeria. After birth, all children are expected to be immunized against some preventable childhood diseases such as polio.
Polio is a viral disease and it's what we call fecal-oral that is transmitted from the feces to the mother, so it's called fecal-oral and then causes a paralytic disease called poliomyelitis.
That was Dr. Ahmed Abdulwahab. He is the Deputy Program Manager for the PRIN MNCH program. PRIN is Partnership for Reviving Routine Immunization in Northern Nigeria. In 1988, the World Health Organization intensified efforts to completely eradicate polio in the world. And since then, polio cases have decreased by over 99%. There are only 3 countries in the world where polio still exists. Nigeria is one of them. The other 2 are Afghanistan and Pakistan. Dr. Ahmed Abdulwahab says polio should not exist in Nigeria as it is preventable.
Polio is one of the vaccine preventable diseases, and we have a vaccine called the oral polio vaccine.
According to the organization PATH, in northern Nigeria, barely 1 in 10 children receives all of their routine vaccines. One of such is the polio vaccine. 4 doses of the live oral polio vaccines are needed. Unfortunately, too few children in northern Nigeria receive even a single dose of vaccine. The World Health Organization (WHO) says polio is not treatable. The polio vaccine is the only way to prevent a child from being affected by polio, which mainly affects children under 5 years of age. In Nigeria, despite intensive efforts to eradicate it in the country, polio persists. Some, like Mohammed Adamu, have blamed poor skills of some vaccinators and poor storage of vaccines for its continued resistance.
So that when I'm a small baby, about getting to one year or 1 year and a half, during the polio time, when the polio people came to us, they went to my mommy as in they want to do me polio injections. So when they're doing injections, the injection is not successful. The person that gives the injection to me is not a professional, so he's getting mistake of the injections. Since from there, then I have this little challenge.
However, Dr. Ahmed Abdulwahab says polio vaccination in itself cannot cause polio infection or paralysis. According to him, an infection can only occur after vaccination if the vaccine loses its effectiveness due to poor storage and exposure to high temperature. Nevertheless, he says there is now a way to detect when polio vaccine is no longer effective and should not be administered.
There is what we call VVM, vaccine vial monitor, attached to the polio vaccine. Is there on each and every vial of the polio vaccine. That one is just to ensure that when the vaccine is exposed to temperature outside the temperature that is normally supposed to be kept, then the VVM changes. And when the VVM changes to stage 3 and 4, we don't use them.
There have been other reasons given why polio still exists in the country. This is what Dr. Abdulwahab calls missed children.
You know, we have been having this what we call polio campaigns, but round after round we have some group of children that don't get immunized, what we call missed children. So because of those challenges that we have, those missed children, so we have a group of children that are not immunized.
He explains the implication of missing some children during vaccination.
We have what we call non-compliance. You have some parents, for various reasons, hiding their children or refusing to bring their children out to get immunized. As long as we continue to have those people that don't believe in polio vaccination, then you will continue to have this problem.
Dr. Ben Ayene is the chairman Health Reform Foundation of Nigeria. He says there are yet more reasons why polio persists in Nigeria.
The primary health care and the centers are not just there. If the primary health care system is working, the vaccines are available when they are needed. And of course, the issue of doing community engagement and sensitization and mobilization and disabusing people's mind. People can go to health centers and access all these vaccines, not just polio, other routine immunization.
Others include rumors on the safety of polio vaccine. In July 2003, for instance, the polio immunization campaign was discontinued in some states in northern Nigeria because some religious and political leaders alleged the vaccine were deliberately contaminated with anti-fertility agent and the HIV virus. In 2004, vaccinations resumed after tests showed the vaccine was not contaminated with anti-fertility agent or HIV. Insecurity in some states in northern Nigeria has also been blamed. In 2013, 9 polio vaccinators in Kano were killed by gunmen and their clinics set on fire as they vaccinated children against the polio virus. Mohammed is now in his 30s. The effect of his polio infection has left him with the inability to use both of his legs. And although he grew up to see himself without legs, some life tasks are still challenging.
The thing affected me, I cannot be able to work, all my nerves is getting weak.
He says he has had to devise a means to survive.
Thank God, I now can be able to move from one place to another, whether with my bicycle or I can, grab down to move around. Managing my charging, downloading music, and other activities.
His bicycle is a locally made wheelchair and skateboard. Many today affected by polio are seen begging on the streets. Mohammed says he would want polio eradicated so that beggars will get off the streets.
That people that are doing polio, they visit a hospital, people that running around to seek people who are not well, to give them medicine so that they will be not begging on the streets.
If polio eradication fails, much of the money spent will have been wasted. And if it succeeds, the world will be polio-free. Dr. Ben says to eradicate polio in Nigeria, the primary healthcare systems in the local government areas should be functional, and polio eradication should stem from the local government areas and not federal.
Immunization being driven at federal level, it shouldn't actually be federal level thing. It should be a state local government thing. But because they are abdicating those responsibilities, that's why you see a lot of emphasis coming from federal level and all those things. Federal level doesn't have HR, human resources, and the capacity to actually do things at gatekeepers level.
He advocates for a schedule of immunization to help eradicate polio in Nigeria.
If actually the routine immunization is properly strengthened and given where it's supposed to be given, which is at primary health centers, and people assess it, you possibly don't even need to go visiting people, wasting all the energy and resources.
Dr. Ahmed Abdulwahab of Prin MNCH agrees.
Government is working to strengthen the routine immunization, which is practically the most important arm of the polio eradication initiative. That routine immunization is a scheme such that every child is given certain vaccines to prevent them against what we call vaccine preventable diseases.
He says strengthening the regular schedule of immunization will yield positive results.
The polio campaign, what we call the polio eradication initiative, has actually 4 components. The first important component is the routine immunization. Then you have the campaign, then you have the surveillance, and then we have what we call smallpox campaigns. We want to get the routine immunization strengthened. So if we have the routine immunization strengthened, then that arm of the polio eradication initiative is being taken care of.
Efforts by parents, government, and health workers need to be intensified to eradicate polio in Nigeria and make Nigeria one more country that is polio-free. According to the World Health Organization, for as long as a single child remains infected, children in all countries are at risk of contracting polio. Failure to eradicate polio from Afghanistan, Pakistan, and Nigeria could result in as many as 200,000 new cases every year within 10 years, all over the world. This ends our report.